So speaking of your operating table, tell us about your book.
Yeah, so stay off my operating table. It really is my mantra, and it really is my mission in life. I want to keep as many people as possible off of the operating table. I want you to not develop heart disease and not need to see me as a heart surgeon. The book came out now about a year and a half ago, doing phenomenally well, number one in many categories on Amazon. And it's really, it's really inspiring to me to see the changes that people get just from reading the book. You don't need to work with me necessarily one-on-one in my medical practice. I have people all the time. You can read the reviews there on Amazon. They read the book, they make the changes, and they're seeing phenomenal results in their life. So that was what I hope to accomplish with the book. My time is limited. My geography is limited. I can only work with so many people one-on-one, but I want to get this message to as many people as possible. And, that's what the book does. Like I said, I'm really pleased with the results it's getting, and we need to just keep spreading the message. My favorite message to get is, I read the book, I made some changes, and then I gave the book to 5 other people, and they're making the changes. And that's how we really have the impact, that exponential growth as this spreads.
Yeah, I definitely love it. It's a great name. Coming from a cardiac surgeon, it's just very powerful to write a book like this and talk like this, because you just don't hear that from your traditional cardiologist. You hear him preach statins, you hear him preach all this drug therapy, and yet, it's not working, like you say. So we've got to do something different. So speaking of drug therapy, hypothetical patient. If you saw a patient with a cholesterol of otherwise generally healthy, low insulin levels, low glucose levels, no diabetes, no obesity, and their cholesterol was 240, and their LDL, total cholesterol, and their LDL was 150, 160, would you put them on a statin?
So, the discussion around this is, very nuanced, and it's really going to depend on individual situations. The vast majority of the time, the answer is no. But there's some more information that I want to get. Ultimately, one of the things I want people to understand is that total cholesterol, LDL cholesterol, are lousy markers. They don't really tell us a whole lot. It's like a 50-50 shot, whether it means anything. And you need to dig deeper. And you need to find a physician who understands this and can dig deeper with you. And there are a number of things that I end up looking at in these scenarios. And you mentioned some of them. I want to know what that patient's metabolic health is. I want to know what their insulin levels are. I want to know if they're insulin sensitive. I want to know what type of cholesterol particles they have. LDL is a class of cholesterol containing particles. And within that, there are small, dense particles, which do predispose to development of heart disease. And there are large, fluffy particles that don't predispose to development of heart disease. And I want to know, which one do you have? And if you have a lot of small, dense particles, the answer is usually not, put you on a medication to lower your overall cholesterol. The answer is address your insulin resistance, which is causing those particles to be small and damaged in the first place. So the vast majority of the time, the answer is going to be no. The other piece of information that I think is very helpful for most people to have is, do you actually have any plaque in the arteries of your heart?
Right.
Or do you not have plaque in the arteries of your heart? There's a test called the coronary artery calcium scan. It's a type of CT scan, very easy to perform, takes 5 minutes. You don't have to put an IV in. Typically, here in the US, the cost is going to be between $50 and $200. Insurance typically won't cover it, but it's relatively inexpensive. And I think it's a worthwhile investment in your health. And it will show us whether or not you have plaque forming in your arteries, because that's a very powerful piece of information when we're trying to do this calculation. Ultimately, what I tell people is if you're not going to address your metabolic health, if you are metabolically unhealthy, if you are insulin resistant, if you are diabetic, and your cholesterol level is high, there may be a small amount of benefit to lowering your cholesterol level, but it's small, and you would get much more impact if you address your metabolic health, if you address your insulin resistance, you reverse your type 2 diabetes, which is very doable. Those are going to be the things that are going to meaningfully impact your risk of developing heart disease.